is an evolving situation. We're dealing with a unique situation, unprecedented like never before. It's an evolving situation, so you will hear us continue to say that. By the time we finish this press conference, there may be more emerging news. But joining me today is Sheriff Sid Gautreaux, Baton Rouge Police Chief Murphy Paul, District Attorney Hiller Moore, and East Baton Rouge Parish Medical Director Dr. Dan Goodby. First, a quick update on our efforts. We had a very successful first day for the MOSEP Community Testing Center at Baton Rouge General Mid-City Campus. You probably heard us talk about that. 183 tests were conducted. Only 11 people showed up without a referral, which means people are paying attention to our message. These tests are sent off to a private lab. It will take 3 to 5 days to get results. I want to stress at this point there are limited tests, so until more tests become available, testing kits become available, only vulnerable individuals should get tested. And that means our elderly population or people with underlying health conditions. Call ahead to your doctor. People who have symptoms, particularly younger people, are still contagious. So for the next several weeks or longer, we need to slow the spread of the virus. That's why we're being so aggressive about limiting our crowd sizes and social distancing. We're practicing that. As you know, Governor Edwards is ordering the closures of bars and theaters and dining rooms. However, we are encouraging our community, as we talk about dining rooms, to do pickup or take out to support our restaurants. We may have to make some big changes during our lives in this season, but the more aggressive we are in adhering to practices such as social distancing, then the quicker we will get through this. Our law enforcement will enforce bans on large crowds. But to speak more about our public safety space, I'm going to ask Sheriff Sid Gautreaux to come forward.
Thank you, Mayor. Good afternoon. For the past month at the Sheriff's Office, we've been changing and adding policies and procedures to meet the needs, to make sure that we're ensuring the public safety as well as the safety of our deputies and as well as with the inmates that are in parish prison. We've implemented a screening process, as you see here, where all personnel coming into the prison will be scanned, given the questionnaire, and have the temperature taken. If anybody exhibits any of the symptoms, then they won't be allowed to enter into the prison. We've suspended all visitation with prisoners. Only bondsmen and attorneys will be allowed without symptoms to enter the prison, and they'll have to do their interviews through glass or by video with the inmates. Nobody's going to have direct contact with the inmates. Also, the warden has worked with our phone provider to have 2 free 10-minute calls per inmate per week. There's going to be no transfers from East Baton Rouge Parish Prison to any other facilities within the state or anywhere for that matter, and that's DOC requirements that have been put in place, so there'll be no transfers. We will not be sending anybody to any other prison for housing, nor will we be able to take anybody from any other prison to East Baton Rouge for housing. We changed up our booking procedure a little bit. As it is before this event has taken place, anybody that's brought to the prison to be booked, if they exhibit any medical problems or issues, they have to be taken to a local hospital facility to be treated or whatever, and they either admit them in the hospital if it's necessary, or they bring them back to the prison. So everybody's going to be evaluated by our medical personnel before they're booked. If they're exhibiting symptoms from COVID-19, they will be taken by the arresting officer to the medical facility for further evaluation. And as I said earlier, we have a section in the prison that the warden has made as an isolation area. So anybody we got to put away from the population for 14 days or whatever the case may be, or tested positive, then they're going to have to stay in those areas. We've also requested the courts to look and see if there are any current inmates who could be released early to reduce the number of inmates and help us out during this time. That's something that has to be agreed on by the judges, by the DA, and by the public defenders. I do not, as sheriff, have the authority to just decide who can get out and who can't. That all has to come to us from the court. They're all put there on court order, and we cannot just release inmates because we feel like they're not that big a threat to make room or for whatever we have to do. So Hiller may want to touch on that a little later. Video arraignments, you know, as you all know, the 19th JDC has suspended court, but we will still be conducting daily arraignments for people that have been arrested that need to be arraigned. It will all be done by video. We have a mock courtroom set up at the prison, and the judges have agreed during this time period to use that video arraignment, so we will not have to be transporting on the average of 100 to 125 inmates from the prison to the court. So that'll be done all the arraignments will be done by video. As far as misdemeanor arrest, we will no longer be booking persons for misdemeanor charges. But let me explain that. With the exception, DWI, domestic violence, or violent offenses. Anything that in that category, whether it's a misdemeanor or not, they're going to be booked. We're working both with the mayor over the next few days, myself, Mayor Broom, Constable Williams. We've been meeting already to try to look at maybe some alternative housing in the event that there is an outbreak at the prison or with new bookies. So we just started working on that, and the mayor, I'm sure, will elaborate on that at a later date if we can work those things out. Let me see. Mayor, you got a fingernail? Thank you. Now let me talk about the criminal division. We're off to prison, but I want to tell you what we're doing in the criminal division. We're going to have all our command staff meetings, any interdepartmental meeting that we have to have will be done by video link in order to limit contact with persons. We've canceled all our training and travel, including our Carter class, which is our basic training class. We suspended all vacation for all essential personnel. We're suspending all work on any traffic grants or things that we have that pay overtime for us to enforce traffic laws or whatever. We're trying to limit direct contact with the public for their safety and our safety as much as we possibly can. As far as answering calls, in order to limit contact in that regards, we're going to do what we have to. We're going to continue to respond to any 911 call, any emergency calls for service such as homicides, attempted homicides, shots fired, crimes of persons and property, disturbances, wrecks. We're going to keep responding to those calls. But a lot of our call volume, the people that are calling really don't want any direct contact. They want us to they want to file a report, and they wish to over the phone. We're going to encourage the public to as much as possible. If we don't have to come out, if we got to come out to investigate a crime scene, collect evidence, talk to witnesses, so forth, we're going to do it. But we're asking them on those non-emergency calls if they would please work with us and let us take their report over the phone. It'll be handled by the deputies as it would be any other situation. We're going to take it from there and work with people to resolve their problems in that regards. But we're really trying to limit the contact with public as much as we can. and we asking people to please cooperate with us. I can assure you that in regards to public safety, we're not going to turn anybody that needs to be in jail away. But if there's certain felony offenses that we can give misdemeanor summons to that don't pose a threat to the public or to the public in general, our personnel and so forth, then we're going to do so. We've been in the process last night, and we've been in the process now for over a month in trying to procure all the necessary protective gear and products that our personnel need to ensure their safety and better serve the community. We're looking at providing additional medical assistance to all personnel that may have come in contact or exhibit any of the symptoms of COVID-19. And we're having the proper decontamination and cleaning and disposal procedure and equipment that will be in place this week to handle any of that.